Still says pre-live for me.
Yeah, you're live now, Councillor.
Hello and good evening, everyone, and welcome to the Alum Rock Ward Forum online meeting. Just a quick welcome to everyone for logging on and attending, and thank you for being here. Following the agenda, agenda item 1 is just a notice of recording. It's just to advise residents that are listening or participating in this meeting that this is an online meeting, and a recording of this meeting will be available for future record. Similarly, the meeting that we had on the 17th of November is available to view if you missed that meeting. It's available on the previous Teams link, and also on a YouTube channel now as well. If you're interested, just drop a comment and we can maybe post a link for that. So agenda item 2, we've got the COVID-19 update. It's the latest information update from public health officers, and in attendance I believe we have Rachel Chapman from Public Health, who will give the latest information regarding COVID-19 and the Tier 3 restrictions that Birmingham finds itself in. So I will at this point invite Rachel to give the update, and at the same time, whilst Rachel is giving that, if residents and people who are watching the meeting have got any questions or comments to Rachel, then please do drop them in the chat box function, and as long as they're relevant to this agenda item, then hopefully they will be addressed. Thank you, Rachel.
Thank you very much, Councillor. Can you hear me okay?
Yes.
Great. Okay, thank you. So I'll give you a quick update, and then, yes, happy to answer any questions. And if there are any that I can't answer, I'll take them back with me to Dr. Justin Varney. So I think we are just about coming up to 12 months since COVID first appeared. It was around this time last year that we started getting the news reports through, and then obviously it hit Birmingham sort of early March time. In terms of where we're at the moment, the latest rate in Birmingham over the last 7 days is about 184 cases per 100,000 of the population, compared to about a week ago where we were running at just over 200, so 225. So it has come down, and we have seen a reduction in rate over the last few weeks. Having said that, we're still above the national average. So the national average is 152 per 100,000. And in terms of local authorities, we are the 35th highest in England and the 6th highest in the West Midlands. So we've still got a way to go with this. All of the data suggests that the majority of the spread of COVID-19 is still through social interactions. So in our sort of day-to-day lives, the social interactions that we're having with each other. And the highest rates that we're seeing are in the 30 to 44-year-olds, so younger adults. The latest hospital admission data weren't available for this forum, but a meeting I was at earlier on this week, certainly we are continuing to see hospital admissions, and our hospitals are working incredibly hard with this. As I say, we have seen a reduction over the last few weeks since we went into lockdown. And really importantly, we have seen a reduction in rates in the over 60s. So individuals who are more likely to suffer from the bad consequences of COVID, more likely to be really ill with it. So it's encouraging that we're seeing these reductions, but we need to do as much as we can to keep the rate reducing. Now, having said that, I then asked for some up-to-date data for Alum Rock, and in terms of rates, the rate in Alum Rock I know has been high, and it is still high. It has come down a little bit over the last few weeks, but it is still quite a lot higher than Birmingham as a whole. So the rate in the last week is 335 per 100,000. So comparing that to Birmingham at 184, you can see that the rate is still significantly higher. In terms of the profile of cases that we see, it's very similar to Birmingham in that it is the younger adults. So the sort of 20 to 39-year-olds really is where we're seeing more of the cases, and a higher proportion of cases in our Asian populations. So that's the pattern that we're seeing locally. Sort of moving on from that, obviously we've now come out of lockdown and into tier 3. And I think that the key message here is it's really important that everybody keeps following the guidance. The hand space message is still so important. So wash your hands regularly. Wear a face covering when you're out and about, and keep that 2-meter social distancing away from other people. It's really, really important that we still keep doing this, because this is the best thing that we can do as individuals to help to stop the spread of the virus. Another key message is about getting tested. I'm going to give you an update on testing, because there is sort of quite a lot happening around this. But first of all, if I can just say, anybody who has any symptoms that they think might be related to COVID, it's really important to get tested as quickly as possible and to stay at home and wait for the results. So in terms of testing sites, we have a number now in Birmingham. We've got good availability for appointments. They do all need to be booked. You can't just turn up. So all of the testing sites need to be booked. Now locally, I think your closest ones are Saltley Health and Wellbeing Centre and Aston University, depending on which way you go. And these are walk-in sites in Birmingham. So as I say, really important to use these if you've got any symptoms at all that might be related to COVID. Just to mention, there is sort of talk in the news about antibody tests. So the tests I'm talking about, where you go when you've got symptoms, are antigen tests. There is an antibody test, which is a blood test to see if you've actually had COVID. These are available for people who work in the NHS and social care, but it's only really research, because all we're looking to do is to see how many people have had COVID so far. You can get it done privately. I think at last look it was about £150. We don't recommend that you do this, because all it will do is tell you whether you've had COVID. It won't tell you whether you're immune. And we know that it is possible to catch it more than once. So in terms of antibody tests, this isn't something that we'd recommend unless you're part of the NHS or social care. I think that what we're hearing quite a lot about in the news at the moment are these new tests called lateral flow tests. And these are the tests that give you a result in a few minutes. So if you go to one of the centres, you have what's called the antigen test, is a PCR test. It has to be sent off to the lab, and it can take a day or two to actually run the test and get the results back. The lateral flow tests do give you the result in half an hour. And the kit itself looks a little bit like a pregnancy test kit, and you get a line if you're negative and a line if you're positive. What we know about these tests is that they are more effective if you've got a higher, what we call a higher viral load. So if you've got more of the virus. So we're actually looking at them in terms of a test of infectiousness to show that you're infectious to other people. So we're looking at using these tests in a slightly different way. So for anybody who thinks they've got symptoms, book in and get one of the PCR tests done. We're looking at how best to use these lateral flow tests in two ways. First of all, it's to look to see who has got an infection, so that obviously we give them advice to stay at home, and also to see who hasn't, which helps them to take part in different aspects of society. So, for example, frontline workers. These tests are going to be really important for frontline workers, where they can get tested regularly and know that they're negative at the point they take the test. Another area where we're using them is to help support care home visits. Anybody with relatives in care homes will know it has been a very difficult time with the lack of ability to visit them. And one of the things that they're trying to do through the care home sector is open up visiting and using lateral flow tests as a way of doing this, so that you can test at the point the visitor gets to the home whether they have got COVID or not. So that's one way that I think they are going to be really useful. We're also looking in certain clinical situations, so for example certain types of appointments at hospital, and other ways that these can be most effectively used. Now, the key thing with any test is it only tells you the result at the point you take the test. So a day or two later, obviously your COVID status might be different. And we also need to be aware that no test is perfect. So it is possible to get a false result. So it's really important that everybody continues to take the other precautions. So the hands, face, space message that I've just been talking about. In terms of how we're going to roll out these lateral flow tests, we're currently piloting them at the NIA, and we're looking at developing like a spoke model, so a hub and spoke model for that. So I think there'll be a lot more news on this over the next couple of weeks. Moving on, in terms of when people get COVID, we do know that some people in the population become much more ill than others with it. And one of the things I'd just like to talk to you briefly is about how you can reduce your risk of becoming very ill with COVID. Justin very much talks about 3 things that you can't change and 3 things that you can. So in terms of the things you can't change, we know you're more likely to become ill if you're older, if you're male, or if you're from an ethnic group that's not white. What I'd like to focus on is the 3 things that you can do something about. So we know that people who smoke are more likely to become ill with COVID. People who are very overweight are also more likely, and people who've got certain chronic diseases that aren't very well controlled, particularly diabetes or heart disease. If these aren't well controlled, people are more likely to become ill with COVID. So in terms of smoking, if you are a smoker, the most important thing you can do for your health is to stop smoking. It can take several attempts to do this, and that we recognise that is a normal process now. So even if you've tried before and it hasn't worked, it's absolutely worth trying again. Stop smoking services are still working. It's done in a different way because it needs to be remote, but it's worth accessing the services because we know people who use the service stop smoking services are more likely to successfully quit. In terms of weight, we very much talk about small changes. So eating a little bit more healthily, doing a little bit of exercise, and a small change can make quite a difference. And then in terms of chronic disease, this is very much about making sure you're on top of your appointments with your GP. If you've got any concerns about the control of your disease, then please get in touch with your GP and discuss that with them. We've got a Be Healthy resource, which is available on the website. And this is a whole series of resources which give you practical information and support about how to stay healthy. There's webinars, there's different tools which can be used, and they're available in different languages. So there's a checklist, there's a sort of getting ready plan, which are available. If I could then just move on to, in terms of vaccines, again, this is another big news item at the moment. So last week or week before, the Pfizer vaccine was approved for use in the UK. I understand it's now also been approved in Canada. The NHS are leading on rolling this out and making it available to everybody, and they have got a huge operation in place to work this out. The priorities have been set nationally for who gets it first. And as I say, the NHS are working out how to do this in the most effective way. Obviously, it will take months to get around the population, but I've been in a meeting today discussing it in terms of how we start getting it to our most vulnerable residents first. There is the Oxford vaccine, which is currently going through the regulatory process, so we're waiting to hear more about that one. I think then just a couple of other things, just to mention our COVID Community Champions. This is a great programme we've got in place where people sign up to be COVID champions, and we can give them information about COVID-19 directly from us, and also it's very much a two-way flow of information, so we can get the information back from our champions about what's going on in the community, anything else that would help. And then just also to mention COVID Marshals. So again, this is a national programme that's being rolled out, which is a very visible way of trying to encourage compliance in our population and with our local businesses. And our COVID Marshals will be encouraging people to wear face coverings and just working with people about how best to be COVID safe. We have the whistleblowing helpline, which is on the council website. They've had well over 2,000 reports now where people have identified businesses where they're concerned that they're perhaps not following the COVID guidance. Every single one of these is looked at and dealt with by our environmental health team. So I would encourage anybody who's got any concerns about an area where they feel it's not COVID safe to report that through the whistleblowing helpline, because then we can look into it. So I think overall the message is we all very much need to carry on doing our bit, especially as we start to approach Christmas with the sort of temporary relaxation of the rules. What we don't want to do is end up in a position after Christmas where we've got a big increase in cases again. What we want to do is try and keep Birmingham as safe as we can, following the guidance, following the hands, face, space message. We know this is a long haul, but it is really, really important that we all do. If we all do our bit, then we will help our population, we'll help our the people who are more at risk of developing the serious side of COVID. So as I say, that the message is if we can all carry on doing our bit, then this will make a difference.
Thank you, Rachel. Is that okay? Yeah, it's come to me.
It. Yep.
No, thank you. Thank you so much for attending the meeting firstly, and then giving us the update on COVID-19 within the ward, and also what it means under Tier 3. There's a number of questions that have appeared in relation to this agenda item, but before I move on to them, some of them have been published. Before I move on to them, I'll hand over to Councillor Idris to ask any questions or comments that he may have for you, Rachel, and then we can go to the questions from members of the public. Councillor Idris.
Yes, thank you, Rachel, for a very comprehensive report. Can I ask where in Alum ward we stand compared to other wards in the city council in the city in terms of where we are in ranking?
Yes, so certainly in terms of numbers, Alum has got the highest number of cases. And I think it has for a little while, and that continues this week, and is also high in terms of rate.
Any particular reasons, I mean,
I would be very interested in feedback from yourselves or from anybody on the call if they've got any thoughts around this. What we are seeing generally is that COVID is spreading through social interactions. So just where people perhaps aren't following the guidance fully, just letting their guard down, if there's more mixing than should be going on, COVID absolutely will take advantage and will spread. And I think with that, from all of the data that we've got, that is what we think is happening most. It is just through social interactions where people are not following the guidance. And as I say, COVID will take any opportunity it can to jump from one person to the next.
And when COVID started in the first phase, it was obvious belief that it affects more to the elderly people. But over time, we are seeing that it is affecting a lot of people within 24 to 54 age groups. So
yes, absolutely right. Certainly in terms of the poor consequences of COVID, it is our older population. And until a few weeks ago, we were very much seeing an increase in cases in our older populations. And that was a real concern for us because it's where we're more likely to see the poor consequences of COVID, and people are more likely to need to go into hospital, and there's all the issues with that. In terms of the most cases, though, you're absolutely right. It's in our working age population. And again, we think this is down to social interactions between people.
And finally, when is the next review, whether we stay in tier 3 or we move downwards? Is it next Wednesday, 16th? Or
yes, that's the date I've got. Yes. So yes, we don't have any clue to that yet. I know they look at a lot of different measures as to what tier we should be in. So that obviously will all be taken into account. So unfortunately, I don't have any insight into it, but we will be watching closely.
And one more, after Christmas and the New Year, do you expect with the Christmas shopping and all that get-togethers, are we going to see obviously a spike in the cases?
I think that's our big worry. Yes. It's great that we're seeing this decrease at the moment. We are very concerned that over the next couple of weeks, as you say, with people out and about shopping, and then over Christmas where families start mixing more, that we've got a real risk of COVID spreading further. And that we will see a spike, that there is a real risk of seeing a spike in January. We want to minimise that as much as we can. Obviously, we don't want to be in a sort of tier 3 lockdown for any time longer than we need to be, and we don't want to put people at risk. So it is the message of everybody doing their bit to try to minimise that.
Okay, thanks very much.
Thank you. Oh,
hi, I was muted.
I still do that after all these months on Teams.
I had to mute it because my child was just behind this door banging on the door, but he's gone now. Anyway, so thank you, Councillor Idris, and thank you, Rachel, for answering Councillor Idris's questions. I've just got one question. It's in relation to what you said in your presentation about COVID marshals. Who are they? Are they Birmingham City Council employees, and where do we expect to find them? And if there is no form of enforcement attached, then how will it work? If I can have some more information about that, because obviously I know enough about COVID champions. I signed up to the scheme as well, but it's the first time I've heard about COVID marshals. So that would be useful if we know who they are, where we expect to see them, what sort of. That's basically my questions. And then obviously, then once you answer this one, then we can move on to the questions that we've got from members of the public.
Of course. So the COVID marshals, whilst they're not enforcement officers themselves, it's very much about encouraging compliance. They could be accompanied by enforcement officers who are able to sort of do that side of things. The team that are leading on this is the environmental health team at the council. So perhaps tomorrow, if it's all right, if I'll ask them just to send you a sort of brief summary answering some of your questions around it. I think there is the opportunity to try and target where we use them. So if you feel that there are areas where this would be helpful, then I think that input would be very much welcomed.
Okay, that's fine. Thank you for that. It's useful to know that it's the environmental health officers, and that information will be helpful. And perhaps actually at a future meeting, depending on where we are, then we might ask them to give an update and see what they've been doing across the city, and hopefully some work in the ward as well. Thank you for that. I'm just going to move on to the questions that we've got. I'll just sort of read them out. Obviously you can see them as well, Rachel, but just for the purpose of the meeting. Hi, during the Christmas break, we have been given permission to visit households. Does that include family in different cities and tiers?
I'm sorry, I can't see those ones.
If I read them out to you, then that just
yeah,
better.
okay.
So during Christmas, did you hear that question?
I did, and I think probably the best thing to do would be to go back and just double check the guidance that's written on this. I don't want to give you the wrong answer.
Okay.
So yes, I think it would be worth just going back and having a look at that.
Okay.
I'm making a note.
If that person, if whoever's, I mean, just for the sake of them having their the question answered before Christmas, if whoever's given that question, send myself or Councillor Idris an email, and just as a reminder, and then we can get that guidance checked for you and sent back to you, just so that you're aware of whether we are allowed to go to different cities in that time, because I'm not sure either.
Sorry, Chair, can I just interrupt? Just for Rachel, for your information, if you go to the published questions, you'll see all the COVID questions in there. So if you move your tab across to publish, you'll see the questions that relate to COVID.
Oh, I think I'm looking at new. That's why. Thank you.
Yes,
that's helpful.
Move across to new. Okay, sorry, Chair. Thank you. Sorry.
No, that's fine. Thank you, Bev. Okay, well, seeing as you can see them anyway, the next one we've got is around COVID champions. What age do you have to be to join as a COVID champion? My son is still at school, but he was interested after the last meeting.
That is a very good question. I know a few weeks ago there was some conversations about whether we could have young people as COVID champions, and I'm not quite sure where that got to. So if it's all right, I can take that back and query it, because I think there was some enthusiasm for young people as COVID champions, because I think it'd be great to spread the message, but I'm just not quite sure where that work got to.
That's fine. I mean, what we'll do is, again, similarly, if whoever's posted that, if you want to send an email, but what I'll also do is, just for the purpose of other people having that information, if Rachel, if you can send me an email whenever you've got that, then I'll post it up on if you have Twitter, I'll post it on my Twitter with a link on how to join and just get that information out there. But equally, you can send me an email and then I'll reply back in the email.
Thank you.
We've got a few questions that are all in relation to Birmingham being missed out from the vaccines and not having access to it. You did briefly touch that. So Alina has asked that question. I had COVID a couple of weeks ago. Is it true that Birmingham won't have access to vaccines? COVID is nasty if you experience it. Heard our cities missed out from getting the vaccines. Is that true? And then I know we've got another one. Why has Birmingham been excluded from the vaccination programme, considered it has one of the higher rates of infection, especially in the BAME communities, along with a high mortality rate in BAME communities? So that's all to do with the vaccine not being available in our cities the moment they were rolled out. Oh, it's frozen for me, Rachel. Can everybody else? Bev, is it frozen on your side? Okay, you're back.
I'm back. Okay, yeah. Thank you. In terms of Birmingham being missed out, absolutely not. No. I know there was the sort of, when the news reports were about the first individuals getting the vaccine, and that wasn't in Birmingham, the QE are working very hard to be giving out the vaccine in the next few days. So Birmingham absolutely is not being missed out. It was just sort of a delay of a few days in terms of actually being able to do that. As I say, I've been in a meeting this afternoon where we've been discussing how best to get the vaccine out to our care homes, to our care home workers, and to our elderly populations in the community. So Birmingham is absolutely not missing out, and the vaccine will be being given in the next few days.
Okay.
Sorry, if I could just add to that, just to say wherever you are, it is going to take obviously a long time to vaccinate the population. So this programme is going to take us months. Well, it's going to take the NHS months to do. So just to be aware of that.
Okay, thank you. Next question is from Rahima. Is there a point in getting young children tested if family are getting symptoms, but the kids seem fine, just one day of a high temperature?
Yes, I would say if anybody in the family develops symptoms, even if they're mild, it's absolutely worth getting them tested. Yes.
Okay. Next question. Bit confused. Are we allowed to mix in bubbles right now in Birmingham or not? And how many is the maximum number we can have together on 25th December, Christmas Day?
So in terms of bubbles right now, no, we can't mix in Birmingham outside of your bubble. In the tier 3 situation that we're in at the moment, people can only meet up in certain public spaces outdoors. Absolutely worth going back to have a look at the guidance, because it does give more detail on that. But bubbles can't mix indoors or in any sort of private space or even in people's gardens at the moment. And in terms of for Christmas, this is about 3 bubbles getting together, but making sure it is only the 3. There's a risk that obviously if 2 bubbles get together and the third one is part of another group, then that is going beyond the 3. So be very, very careful in terms of it only being the 3 households getting together as a bubble for Christmas.
Oh, sorry. Does that then mean that if your household is going to join in Christmas celebrations or family get together with 2 other households, then your household shouldn't mix with another one on a separate day, on a different gathering?
Yes, you need to form that bubble of 3 households for over Christmas. If you start then mixing into other bubbles, then that's when COVID has got a real chance of spreading.
That just seems like a nightmare. It seems like the perfect way to spread it further if it does mix beyond. Okay, well, I think that's really useful information, just because it's almost as though people think that 3 households can mix over a period of 5 days, or how is it 23rd till the 27th of December, if I'm right?
Yeah, I'm going to take that back to our communications team to make sure that we've got some really clear messaging about that.
Yes, I think that would be really useful, that if you're part of that, if your household is part of a bubble of 2 other households, to stick to that bubble during the 5-day period and not think it means you can attend a party at one person's house and you can go to a gathering at another person's house, because obviously that just doesn't make much sense. Whilst we've been having this conversation, Councillor Idris did indicate, so I think it's in relation to this. Did you want to step in? You're muted. Haha, you did it as well.
Yeah. Is there any research about how COVID-19 affects people of different blood groups?
Ooh. I don't know of any. I can dig. I tell you, I'm going to ask Justin that one.
Okay. Thank you. Does it make sense to let people mix for Christmas if rates are going higher? Will there be another lockdown in January then?
In terms of, obviously this has been a political decision as to what to do over the Christmas period. We don't know what will happen in January, but the more that people mix outside of their bubbles, then the greater the chances that we will go into another lockdown or a high tier after Christmas.
Okay. And then the rates are increasing in Alum Rock because people are still too relaxed. Hardly any masks on, no social distancing. Are there any fines actually happening?
So yes, I think your point is very valid, that rates in areas do increase where people aren't following the guidance. And I'm wondering, Councillor Khan, when I have a word with environmental health, it might be something that you want to consider in terms of the COVID marshals. It's about really sort of spreading and promoting how to be COVID safe. So it might be something that's worth considering in the area.
Thank you. And the last comment, I will read it out and then I'll explain it. It says Wednesday 10 AM till 4 PM, Fox and Goose shopping area, Stetchford Retail Park and the roads off it. Thursday 10 till 4 PM, Washford Heath Road, Alum Rock Road. Friday 10 till 4 PM, Horsey Green down to Belchers Lane and across past Heartlands Hospital, Green Lane. Revisits for problems found earlier in the week. Now, to anybody else, that just means absolutely nothing because you don't know the background behind that. But I've just had a message from our local police sergeant, who is Sergeant Chowdhury, who is watching and is part of this meeting externally, but he's just told me that he's having some technical issues. But that comment is in relation to the COVID marshals. So he's just told me that the Birmingham City Council COVID marshals, along with the neighbourhood policing team, have been patrolling, and these are the areas that they have been patrolling this week. So Wednesday 10 till 4 was Fox and Goose. Today they did Washford Heath Road, and tomorrow they will be going on to Belchers Lane, and that's the time period that they will be there. And then if there are any problems found earlier in the week, they will be revisiting those locations. So that's
brilliant. Thank you.
So when that was published, I thought this seems like it's in relation to COVID marshals, but I don't know who's telling me what. But then I just had a message from Sergeant Chowdhury to explain that. So that's just for information purposes. So you know, residents are aware that it is happening, and these are the places that have been visited this week, both with the council's marshals and the police team. So that's useful information. Thank you for that, Sergeant Chowdhury. I'm just going to have a look to see if there are any more questions in relation to COVID. There doesn't seem to be any more questions that I've got around COVID, but I think that we've more or less answered all of the ones that we've got, and those that are not able to be answered right now, we've noted those questions for information to come back. So thank you so much, Rachel, for attending, giving us a presentation and answering the questions. I'm just going to check if Councillor Idris has got any other comments or questions to yourself before we move forward. Councillor Idris, do you have anything?
No, thank you.
Okay, that's fine. Thank you. I think obviously, given the circumstances in the world that we currently live in, maybe at a future meeting another update might be useful, so we can invite public health officers at a future meeting if it seems like it's important to do so. Thank you again.
Thank you very much for having me, and certainly yes, you know, anything else we can help with.
Thank you.
Thank you. Bye-bye.
Bye. Okay. So we can now move on to the next agenda item, which are local updates. Unfortunately, the first one that we did have from Kier Highway Services, we won't be having that ward maintenance plan, as Kevin, who was due to attend, has unfortunately fallen unwell and isn't able to be at the meeting today. So we send you know, our best wishes to Kevin for a quick recovery, but we won't have that update at this meeting. There are a number of questions, I think, that are in relation to this agenda item, so they will be posted, and if you've got any other questions in relation to this, then again, please email and we will ensure to get those answered for the next meeting. I'm going to read the questions out just for information purposes. As an ordinary person living here, how do we report things like faulty street light or potholes or things like that to do with highways? Not everyone will be in meetings like this, so what's the best way? So there's I wanted to hear about the plans for maintenance on roadworks. If the highway person isn't here, will we have a chance at the next meeting? Yes, so the Kier Highway Services should be on the agenda under local updates for a future meeting. So hopefully you'll be able to you'll have a chance to get those questions answered. I'm just having a quick look through. Okay, that's fine. So we can then move on to the next agenda item, Councillor Idris, for the ward councillors update. I can hand over to yourself and you can give the update on behalf of both of us. And if there's anything else that I think needs to be added, or if there's anything that you may have missed off, then I'll just chip in at the end of this. But I'll hand over to you, Councillor Idris, to give your update.
Thank you, Councillor Khan. I've got some good news for the residents, and I will begin with the 5G application for telecommunications mast on the corner of Ash Road and Hall Road, which, as you know, we opposed it with a lot of other residents, and we can report that it's been refused. And otherwise, it would have been a very eyesore site if it was successful, and would have created a lot of problems for the local residents. And my second good news is that a planning application has been submitted for a new state-of-the-art mosque with a lot of other exciting projects on Brook Hill, corner of Brook Hill Road and Alum Road. And we, both councillors, have supported it, and along with Liam Byrne, and it will be a very 15-20 million plus project, very exciting project. And we got build mosque in our ward. You know, we got St. Saviour's Road, we got Ash Road, we got very exciting mosque, big mosque on Church Road, and this will be another very good addition to all the good mosque, big mosque that we got, and it will be a unique project. And I think the local residents and particularly the youth will be able to enjoy a lot of facilities from this one. And my third good news is that a planning application has been submitted for a Leyland Social Club on Alum Road. It's been an eyesore for the last 25-30 years, and finally a mixed-use application has been submitted for some residential good quality houses and about 15 retail units, and it will expand the local business district, and it will be an exciting development which both of us are supporting, and I hope that it will be successful. And the Union Leadership Academy school program is on target, and next September the classes will be starting, and it's I would request the parents for their children, if they want to apply after January, they can apply for new places for next summer's session. So once it's completed, it will be a very exciting building and an exciting project. And we were waiting for Kier to give us a brief on roadworks and tree pruning, but as they have not been able to, but we will not invite them for next meeting in January. And in terms of fly tipping, although we still have a problem, but in the last 6 to 8 weeks, we are seeing marked progress on this. And although there are still problems for litter picking and street cleansing, and there are factors for it because of the COVID-19. When people get symptoms, or their household, you know, the workers get symptoms, they have to isolate. So we already have a very depleted workforce in this field, but as we are getting into better times in the next few months, we will see a marked improvement in this service. And is there anything else you want to add, or?
Thank you, Councillor Idris. I was almost about to make the same mistake and start talking whilst it was muted. Thank you for giving the updates on both of our behalves. The only other things I'd like to add, I think, are just for information purposes, just so that residents have got information to note. There's just a couple of them. So in relation to waste collection over the Christmas period, our ward isn't affected. So there won't be any collections of refuse or recycling on Christmas Day, which is Friday the 25th, and only household waste will be picked up on the bank holiday Monday the 28th of December and New Year's Day Friday the 1st of January. No recycling will be collected on those 2 days. We won't be impacted. So if there are any missed collections on specific roads, then please do contact myself or Councillor Idris to inform us, but there isn't a planned, it's not in the plan to have our ward affected by this. I think, and the other comment is that the depots the refuse depots, our 5 HRCs are closed on Christmas Day and Boxing Day, but they will be open and there's access for residents across the rest of the holiday period. Bookings to be made online as usual. So that's just information to know. And the other thing is in relation to garden waste collections. So on the 4th of December was the last garden waste collection for this year. And if you're interested in garden waste collection for 2021, in the next coming weeks, there is planned for that to be opened up for sale, and collections to be planned to start in March 2021. So if you're interested in getting your garden waste ordered for next year, then in the next few weeks you will be able to do so. And this is, I've been contacted by 2 parents in the past week about school spaces. So I just thought it might be useful for us to give this information to residents, just so that you are aware. Families with children due to start reception class in September next year should apply for their children's school space before the deadline of the 15th of January. So you've got until the 15th of January to make sure that the application has been handed in. If you've got any questions or if you need any advice on the application process, then you can contact, again, myself or Councillor Idris for that. And I'm just going to check to see if there's any other
Mariam, somebody's asked about HMOs.
Yeah, I'm just. Did you want to address that question? Just a second. So we've just seen. Apologies if this is now slightly boring for you to sit and watch.
I can answer on HMOs. If any residents, get information about HMOs, the planning department should be writing to the next door neighbors, and about 5 or 6 on either side of those houses which are being converted, and they can object to that, and they can also let us know if any development is happening. Then we can object to it as well, and they can organize petitions, not at the moment, but when things get better regarding COVID, they can let us know and we can organize petitions.
Okay, so just adding on to that, we're seeing more social housing and HMOs in Alum Rock, and Councillor Idris and Miriam tell us the process of objecting applications. And can councillors lead on the campaign as we're seeing offenders being located in Alum Rock and seeing all forms of antisocial behaviour, drugs and a rising crime? What will our two councillors be doing to tackle this, and can we elaborate? So Councillor Idris has already addressed this around HMOs. The process should be that if an HMO is set to be convertible, if a property is set to be converted into an HMO, then the residents who live nearby should be informed of this. If in an instance you're not informed and you live nearby and you find out afterwards, then please do contact ourselves, and we can check to see what's happened there. But the process, Councillor Idris has already stated that you can submit individual objections, or local residents can sort out petitions. Obviously, because of COVID, knocking and doing door-to-door petition signing isn't advisable, and I'd say do not do that. But there are other ways of doing petitions. Obviously, there's online petitions. If obviously people have got each other's phone numbers with their neighbours, things like that, they can then maybe do an online sort of petition and then submit those to the planning department. If you're having any issues with individual cases of HMOs within the ward that you're aware of, where there is antisocial behaviour, there's drugs and a rise in crime, then do tell us, because we'll work with the police to address the issues, and then also with the council to see what can be done if the issues are ongoing and persistent. Just having a look. Apologies, we're just having a look to see if there's so there's a couple of questions about okay, apologies for the slight pause. What we'll do is move on to the next agenda item, because the questions are, some of the questions I've noticed are linking in relation to the local police team, or there's comments directly for the police. I know that okay, before I move forward, sorry, I've just had another comment come in. Social housing and HMOs should be an agenda item for next meeting. Can we have a Zoom meeting so residents can get involved in discussion? This is a one-sided meeting. So in relation to social housing and HMOs, that is something that we can look into having at a future meeting. If there's anybody in particular, to the resident who's just posted that, anybody in particular that you'd be interested in hearing from, obviously we'll speak to the council officers in the planning department, and we'll request for somebody to be available to give us an update and respond to questions on HMOs. And in relation to the platform that is being used for meetings, Zoom isn't the platform that the council is using for ward forums and meetings. It is Microsoft Teams, and at the moment, unfortunately, this is the way that we are conducting our meetings during this COVID period. Obviously, when we are in a position to have meetings face to face where it is safe to do so, we will revert back to having those meetings. But at the moment, the chat box function is there in order for people to be able to comment and post their questions. And obviously, even if we were to have a face-to-face meeting, there's always limited times that officers have got, councillors have got, attendees have got, and not all questions are always answered during the course of the meeting. Sometimes not all of the answers are available during the course of the meeting, so it is a case of somebody getting information and bringing that back, like we had the public health officers, Rachel, who said that she will get back to us with some of the information. That was some of the questions that have been asked in this meeting. So in response to Zoom being used as a platform, take on board your request, but unfortunately it will have to remain this Microsoft Teams live setup. But definitely the social housing and HMOs being the agenda item, I'm happy for that to happen. And Councillor Idris, I think that you'd agree that we can have that as an agenda item for the next meeting. We did try to get housing on at this meeting, but unfortunately, as you're aware, Councillor Idris, we weren't able to arrange for them to attend. So it was actually in the plan, not specifically HMOs, but housing was definitely supposed to be in this, was supposed to be in attendance for this meeting. But next time we'll definitely do our best to get somebody there to be able to answer the questions that you have regarding HMOs. Councillor Idris, is there anything else that you wanted to add to that?
No, thank you.
Okay. Okay, well then we can move on then to the next agenda item, which is a local police team. Unfortunately, talking about platforms, the police are not able to join in to this meeting the way in which other council officers and myself and Councillor Idris are here. So we have got the report, the up-to-date report from the Washford Heath Neighbourhood Policing team sent to us. You should be able to access that from the council's meeting page website. I'll ask if Bev or somebody, maybe if somebody can just post a link into the chat box so that people can get access to that if you haven't already got it. If you will, if you can just. What I'll do is I'll start going through the document. I'm just checking to see.
Councillor Khan, it's Bev here. I'm happy to send the report out as well to everybody following the meeting.
Okay, that's fine. I was just checking to see if anybody wants to follow
I'll do that as well.
Okay, that's fine.
That's fine. I'll send it out as well following the meeting.
What I'll do is I'm just going to read through the report as though I'm Sergeant Chowdhury. Obviously I'm not, but there's some crime headline statistics which residents can read themselves, but I'm just going to read the last few sort of bullet points. This month, two drug warrants have been executed on the ward. The first relates to a cannabis factory on Glen Park Road, where approximately 250 plants were seized and 2 males were arrested. The second address was on Ludlow Road, where a large amount of Class A was found and 1 male was arrested. Also this month, 5 men have been charged who are believed to be involved in supplying drugs. The arrests came after investigations into drug supply chain on Birmingham East. Warrants were executed at 10 addresses. During the course of the investigation, firearms, drugs and a large quantity of cash was seized. All 4 men are from the Ward End or Alum Rock area and 1 from Bordesley Green, and they appeared before the Birmingham Magistrates Court on the 5th of December. One other incident of note was the arrest of a male on suspicion of burglary, dwellings or household. The attacked premises were on Monk Road, Ward End. Number of officers attended the address location within minutes of the crime being reported. The male was located nearby and arrested as he attempted to flee. A vehicle thought to have been used or involved was also seized for forensic opportunities, and the investigation is ongoing. Officers have been working hard to manage known perpetrators by conducting regular home curfew visits and expediting inquiries to identify offenders and make prompt arrests. Officers have continued to conduct weapon sweeps, knife arch ops, hotspot locations, targeted patrol and school visits and talks. And officers have been out and about engaging with residents, pressing the message for residents to remain vigilant. We've been advising our residents on crime prevention, i.e. locking back doors and windows during the night, not to leave valuables on display outside unattended vehicles, and we send weekly messages via West Midlands Now to inform local residents on any neighbourhood issues or crime so that they can keep up to date and stay safe. This is also helping us build strong relationships with the public. We have engaged with members of the public and have encouraged them to work with us via Neighbourhood Watch, Street Watch and Faith Watch to help us to engage with the community to prevent crime, help those in need and to protect the public. The team are still actively recruiting residents to our Street Watch, Faith Watch, Business Watch and Neighbourhood Watch schemes. If anyone is interested to setting any of the schemes up, please do contact the neighbourhood policing team. PCSOs Ahmed, Cooper and I think it's Tony are leading the initiative. So if you're interested in being involved in any of those residents groups or setting something similar up yourselves, maybe on your road, in your street, in your neighbourhood, then please do contact the local neighbourhood policing team. I just thought it would be useful for us to hear it rather than just having the document presented. In a normal meeting, if we were having a face-to-face meeting, either the sergeant or a police officer would be in attendance to be able to give the report and also answer any questions. I'm just going to read out another, I think it was a comment to the police. So, okay, so this question. Hi, my question is for the police. Is there a point in reporting drug dealing on our road if nothing will be done? Obviously, I'm not the police officer, so I'm not going to be able to answer that like a police officer, but my response would be, yes, definitely do report any crime that you see. 101 would be the way in which to report crime that's not an emergency, and continue to do so with any information that you may have. That might be car registration, that might be a description of a person, it might be knowing what house somebody is visiting, coming in and out of, because as the more information that the police receive, the better chance it is that they would be able to maybe, if it's of drugs being grown in a property, getting a warrant, that sort of thing, or increasing their patrols, or basically being a bit more visible when they are doing operations. It's useful for them to have information like what you're saying, and reporting is definitely crucial in order for the police to continue the job, the good work that they are doing. This is a comment saying, just want to say thanks to the police for removing a car on my road that didn't have road tax. Parking is a joke as it is, so we don't need those illegal cars taking up spaces, so thanks. So that's just a positive feedback to the police for the work that they are doing. I'm just having a look to see if there's any other questions in relation to the police. So this one isn't directly related to the police, but it can be. Birthday party going on right now on my road. People's attitudes need to change. I think it goes back to, it's obviously linking in with COVID restrictions, tier 3, and the work that the police have been doing in dealing with, where there's breaches of the rules that we've got in place. It's a shame that people's attitudes are still like that, and I'd say that reporting, if you think that there's a situation where people are unsafe and it's not the right thing to do, reporting is crucial there as well. Just going to have another quick look through to what's the stats for the March. Apologies, I'm just checking to see if there's any other questions for the police. There doesn't seem to be any more in relation to this agenda item, so we can move forward to the next agenda item, unless Councillor Idris, is there anything that you wanted to add to this item before we move on?
I'm muted. I just want to say that, police have been doing very excellent work for the last couple of months, and they have been very successful in catching the drug dealers and cannabis plants. And there is a lot of work going on that people don't see, but behind the scenes, there is some good work being carried by the police and their partners. So I just want to say that.
Thank you. I echo the comments that Councillor Cllrs has made. I agree wholeheartedly with what you've just said in relation to the work the police have been doing. I think we can now move forward to the next agenda item, which is Housing 21. It's a co-housing development project for older people. The age range is over the age of 60. The information leaflets and the document was attached, should have been attached to the invitation link for this meeting. I know it's definitely on the council's website because I've seen it on there, but I can give a little bit of an introduction and then I can pass over to Councillor Cllrs to talk about it a little bit more. Basically, Housing 21, it's a vision for a development for co-housing for older people within our ward. So, so within Alum Rock, Housing 21 is an organisation alongside Birmingham City Council. They've identified an area of land to provide housing and communal facilities for local older people. So the site that we're talking about, or the space that we're talking about, is on the Washford Heath Road, opposite Hutton Road. So you may be aware that there's an empty space of land that's there. So the plan is for housing to be developed on that site. But the difference with this housing plan is that they are asking and appealing to local elderly people over the age of 60 to have an opportunity to plan and design and then obviously then live in those new homes. So it's something that we've never had before. I haven't met with Housing 21 as of yet, but I know that Councillor Cllrs has. So I can hand over to you, Councillor Cllrs, if you want to give any more information around Housing 21. And then there's a couple of questions as well that I've seen. So Councillor Cllrs.
Yeah, thank you, Chair. As you given a brief description, Housing 21 is a leading not-for-profit provider of housing and care for the people who are over 60 years of age. And last year had a meeting with one of their representatives. And as you mentioned, they're in Birmingham, they've got two sites, one on Washford Heath Road and one in Cllrs. And co-housing is a very new and unique concept. And there's only 19 such schemes throughout the UK. So you can imagine how special this scheme is. And it's mainly for elderly people. And it's very local led because of the COVID. A lot of progress has been hindered because last year when I had a meeting by summer, they should have been having meetings with the local residents, but because of the COVID that has not been possible. But we're hoping that by spring, when things get better with COVID, we should be able to organize meetings with the Housing 21 representative, with local groups and local elderly people. And as I mentioned, it's very local led, and the local people will be able to give feedback about the designs and what sort of services they want. And one or two questions Rohima has asked from my initial meeting, and looking at their history, they are very flexible. And she asks if somebody is not 60 or lower than 60, and somebody is 60 moving into one of the units, and can they move with them? And my answer is that if they are lending support to the elderly person, or if they are caring, and they are very flexible, and I don't see any problem with that. But we can feed these sort of questions when we have one-to-one meetings with them. And also she asked, if somebody is in a position to buy, and my answer is that they are flexible on that, and somebody can demonstrate that they have got the resources to purchase, and they can be very flexible on that as well. So it is a very exciting scheme, and for Birmingham it's going to be only 2 at the moment, one on Washwood Road and one in Lozelles. And as I said, it's very local led, and it will be very useful. There's a great need for elderly people. They have been looking for such accommodation like in St. Peter's College, but they're already fully occupied. So this is something very exciting, and we are looking forward to it. I'm happy to ask any questions if there are any, answer any questions.
Thank you, Councillor Idris. We've got a couple of comments. I know you've already addressed some of the questions. I've seen the housing leaflet, and I'm curious if once the houses are built, can they be sold or they're just for rent? So you've already answered that they are flexible with regards to sale. To get involved with the housing plan, do you have to be over 60? Yes, so as far as I'm aware, they are directly appealing to people over the age of 60 for the exact reason that they want it to be a development where the people who will be ideally essentially living in that housing scheme are the ones who have been involved in shaping it and designing it. So the answer to that is yes. If you've got any, elderly relatives, or if you're over the age of 60 yourself, if you've got any elderly relatives or friends that you think might be interested in being involved, then the information is on the leaflet. You can contact them and tell them that you are interested. How many houses are being built? So for
25.
This
Yes, 25.
Okay, so it's 25 houses for this specific site. Thank you. Sorry. So who are Housing 21 and why have they residents not been consulted before the agreed partnership? The local should have been on the board at least. It seems we, the residents, get told when things have already been signed off and finished. So I think the information about Housing 21 is available to everyone. It's on the council's website under this meeting. You can, if you haven't got the leaflet already, you're able to get access to that, and it gives you all the information on who they are. And I think the last comment that you said about the residents don't get involved and they find out afterwards, the whole purpose of what we're doing right now by having this as an agenda item at this meeting is so that residents can get involved and help shape the housing scheme by giving their views on what would be the best facilities and things like that for the local people who hopefully will be moving into these houses. So this isn't one of those where it's already been decided and done. The thing is that they're asking local people to help design the project. So I'm just looking to see if there's any other information that is on the leaflet. Councillor Idris, did you want to say something about this?
Yeah, I just want to say that it's a quite big housing association, and they got 20,000 properties throughout the UK that they manage and look after. So they are quite unique, and they only cater for and provide service of 60 plus. Yeah.
So they provide retirement housing and extra care for older people. So that's who they are, and they are keen to work with the Birmingham City Council in delivering their vision and supporting the city and meeting the needs of elderly people, especially in the disadvantaged communities living in the inner cities. So I think we're quite lucky, I would say, that our ward is one of two that have been chosen to have this scheme, and I think it's a really good opportunity for local people to get involved and to get on board with this project, and especially because it specifically asks for people who are over the age of 60. It's unique in that sense as well, that it gives them a chance to help shape it. There aren't any other questions in relation to this housing scheme. The information is on there. Residents, if you want to get involved, or if you know elderly people who would want to get involved, then you can contact them directly. I'm due to meet with them next week, I think, and if there's any other information that I find out from Housing 21, I think would be useful for residents to be aware of, then I can bring it to a future meeting. Sorry, I'm just checking. Councillor Idris, can you see this? Local lad was mentioned by Councillor Idris. Who's the local lad? I don't think I understand what that's in relation to. Okay, right. I think we can actually move to the end of this meeting. There's a couple of questions asking about a date for future meetings. So I'm just going to publish those questions. Just before I move on to the date of the next meeting, there's a few comments about that I've just seen, which I'm just having a look at the last comments. I think it's in relation to Councillor Idris, when you were talking about the planning applications, about the shop units on the Leyland site. There's comments to say that it will increase parking problems and it will increase litter, and commercial bins will be left on the highway or the pavement. Obviously, we've already discussed this when we've had in our last meeting, when we had the cabinet member in attendance, around commercial waste and the issues that we have and the issues that we face on the Alum Rock Road in relation to fly tipping and waste. I think that, you know, what we'd say is that it's an ongoing problem, it's an ongoing issue, and the council's team and the waste management team are doing whatever they can to try and tackle it. Obviously, if there's any comments that anybody would like to add on any application or planning application, whether it's comments to support or comments to object to planning applications, then I would advise you to use that route to express your concerns. And yes, Councillor Idris.
Somebody said about local lads. What I meant was, you know, the young people. When in the mosque, you know, on Brook Hill Road, there will be sports facilities as well, sports hall as well. So what I meant was, young people can use those sports facilities.
Okay, thank you. So that wasn't in relation to the Housing 21 scheme. You were talking about the planning application for the Brook Hill Road.
Yeah, I didn't say anything about Housing 21. I didn't.
Okay, so I think that might have just been miscommunication or a misunderstanding, but you've clarified that. And I think what we can do is just have a look at the last couple of questions. People are interested in a future meeting. Is there a date for future meetings? When is the next meeting planned for? There isn't a date on the poster this time. So we're pleased to announce that we have got a proposed date for the next meeting for the Alum Rock Ward Forum to take place on the 21st of January at 6 p.m. As soon as this is finalised, this is just proposed date, as soon as it's finalised, it will be up on the council's website, but we have full intention for it to take place on the 21st of January at 6 p.m. and it will be an online meeting again due to we're still living in this COVID world, so unfortunately it won't be face to face next year, but we'll see what happens later on in the year to see if we can move to having face to face meetings. So that's all I'd like to say and comment on. Councillor Idris, if there's anything else that you would like to say before we close this meeting.
Just want to, somebody said, Councillor Idris said about Housing 21, there's a local led. I don't recall saying anything. I said it's local led, not local led.
Okay, it's local led, as in local people can lead this initiative forward. So there aren't any local young people involved in this because, as we've already said, it is for people over the age of 60. So there probably won't be any local younger people or anyone under the age of 60 who are involved in helping shape this scheme. Okay, that's all. I'd like to thank everybody for attending, for giving us your questions, commenting, and for being here and joining this online meeting. Like I said, 21st of January is the date for the next meeting. Taking on board the comment that somebody raised about HMOs and social housing being on the agenda for next meeting. We will do our utmost best to ensure that that happens. And unfortunately, it will still be a Microsoft Teams live format. So we will continue to have meetings like this. I'm just having a look if there's any other comments or questions that haven't been addressed. If you think that they haven't been picked up, if they haven't come up on my screen, then you're able to again send us an email. And the questions that were asked to public health that haven't been answered, because Rachel should be emailing me those, please do email me the question that you originally asked so that I can forward the response from Rachel to yourselves. Hopefully you are still watching, or if not, you're able to come back and watch this as a recorded meeting. That's all. Thank you once again, and I hope everybody has a good rest of the evening. And during the holiday period over Christmas and the New Year, I'd like to encourage all residents to please stay safe and follow the guidelines and the restrictions that are in place, and especially over the 5-day period where we are allowed to mix in with other households, to stick to the 3-household bubble that you create. And hopefully we shall see you in the new year. Councillor Idris, if you'd like to say anything before we end the meeting. Thank you, everybody.
I just want to thank you and Bev and all the participants. And if people got any questions, they can email to us and we will address them.
Thank you. Bye.
Bye.